Hi, I'm Sameer Gupta and I'm an interventional cardiologist. Now we all know that exercise is good for you and it has benefits in almost every organ and every part of your body. But the question is, how much exercise should we do? And is the exercise we are doing effective or not? Now the American Heart Association recommends a moderate level exercise for 30 minutes about 5 times a week, totaling of about 150 minutes of moderate intensity exercise or 25 minutes of vigorous exercise 3 times a week. That's about 75 minutes of vigorous exercise 3 times a week, or 75 minutes of vigorous exercise in total. The question is, what is moderate exercise and what is vigorous exercise? Moderate exercise is like going for a walk at about 3 to 6 kilometers an hour for 30 minutes. Typically, your heart rate should go up during moderate exercise to about 50 to 70% of your goal heart rate. I'll talk about the goal heart rate in a second. And a high intensity or a vigorous exercise means you're doing 7 to 8 or even 9 kilometers an hour on the treadmill. So that's pretty vigorous. Your heart rate typically tends to go up a little bit more than it would if you were at a lower speed. And this heart rate that goes up should be at about 70 to 85% of your target heart rate. Now the question is, what is your target heart rate? So how do we calculate your target heart rate? Your target heart rate varies for every individual depending upon your age. So if you're a 40-year-old person, your target heart rate would be 220 minus your age, which is 40 in this case. So it should be 220 minus 40, that is 180. So your goal should be, if you're doing vigorous exercise, to be between 70 and 85% of 180. For moderate level exercise, your target heart rate would be 50 to 70% of your target heart rate, or 50 to 70% of 180 in this case. Make sure you reach your exercise goals so it can be effective and good for your heart.